Good afternoon and welcome to Webinar Wednesday in this our 9th year of offering up-to-date and informative webinars to the HTM industry. Today we are joined by Chad Holmes, Security Evangelist at Cynerio, and James Miller, National Security Specialist at Cynerio. Webinar Wednesday would like to thank our sponsor Cynerio. Cynerio has one simple goal: to secure every IoT, IoMT, OT and IT device in healthcare environments, with capabilities ranging from micro-segmentation and improved device insight to identifying exposed EPHI and stopping ransomware. Cynerio protects hospitals from a variety of modern cyber attacks. Learn more about Cynerio at cynerio.com. Just a reminder that TechNation is headed to our Spring ND Expo at the Woodlands Waterway Marriott Hotel and Convention Center in Houston, Texas, from April the 11th to the 13th. Join us for 3 days of education, networking, and the latest advances in medical technology products and services. Registration is open, so for more details, please visit ndexposhow.com. Today's webinar is eligible for 1 CE credit from the ACI, and you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. Let's kick off today's webinar by giving away one of our Webinar Wednesday t-shirts to the attendee that can tell me the answer to the following trivia question. 2023 is the Chinese Year of the Rabbit. Which famous rabbit's catchphrase is "What's up, Doc"? Answer now using the questions feature on your dashboard, and I'll reveal the answer at the end of the webinar. We'll wrap up today's presentation with a live Q&A, so please submit your questions anytime using the questions feature on the webinar dashboard. As I mentioned earlier, our presenters today are Chad Holmes and James Miller, who will be discussing real-time medical device visibility and security in action. So Chad, you may begin whenever you're ready.
Great, thank you for the great introduction as always, and thank you all for joining me today. As Linda said, we are going to talk a little bit about how security systems that more and more healthcare systems are deploying to help protect against cyber attacks can actually be used by biomed, HTM, and clinical engineering teams to improve their day-to-day effectiveness as well. Now, we have heard some feedback from some of our previous presentations that you want to see more and more demos in deeper detail. So I have James on the line today to help me out. So James is a network security specialist. He can answer any and every question you send his way, whether it's about how to find a device, how to secure a device, how to segment a network. And if he can't, he can at least find the answer for you. So I do challenge you to ask questions as we go through. And my name is Chad Holmes. I'm a security evangelist, and that means I get to work with smart folks like James, with our engineering team, and with others to help healthcare systems secure their environments. So all these nasty ransomware, malware, phishing, et cetera, attacks that we're seeing are not impacting patients either directly or indirectly. If you haven't heard of Cynerio before, we were founded 5 or 6 years ago with one really simple goal. We want to secure every IoT, OT, and medical device in healthcare environments. And while that's rather easy to say, to actually do it is really challenging. And I think we've all seen headlines and know multiple examples of how difficult it really is to secure healthcare environments, particularly with all those pesky IV pumps and patient monitors and Teslas and gaming systems that are on the network and introducing risk. Now, over the course of the last several years, we have started to get recognized more and more for the protections that we're providing to our customers. We were named a Gartner Cool Vendor. We also named a Forrester Wave Leader. And about 1.5 years ago, KLAS started studying us as well, doing anonymized surveys with our customers. And we're very proud to have a KLAS ranking of 96.1. So many thanks to any of our customers that are out there and have contributed that great feedback about our offerings. Now, today's webinar is one in a long series of webinars that we continue to build upon with TechNation. So many thanks to the Webinar Wednesday team. We did have a webinar that closed out last year about active attacks on healthcare, where we talk about the types of attacks that we're seeing in healthcare. If you want to learn more details about that, I'll have some details later on in this presentation about an even deeper version of that, where we get into the really deep details about the specific attacks that are happening. So many thanks to everyone that gave feedback on that session from last month. Additionally, we've worked with partners like HSS and Nuvolo to talk about how security and biomed teams can work together. So if you're looking to learn about any of those topics, feel free to go to the Webinar Wednesday catalog on YouTube, and you can find those and many, many other topics on there. It's a great, great resource for that back catalog. Now, more importantly, what we're going to talk about today, I'm going to give you 2 cybersecurity details up front, simply because there's some cybersecurity information that we've shared in other webinars that people ask us to always share and find a lot of value in. So I'm going to give you a quick slide on the state of healthcare cybersecurity, give you some very basic stats you can use if people are talking about cybersecurity in your organization. And then I'm going to give you a cheat sheet, which we first introduced in the last webinar that people really liked, about what biomeds in particular can do during an attack to help stop the attack and, more importantly, help protect patients. Once we have those, I'm going to hand it off to James, and he's going to go through biomed-specific functionality in the Cynerio platform. While we focus a lot on cybersecurity, which is, I think, pretty clear based on some of the topics here, we do have a lot of functionality that biomed teams find very, very valuable. This can range from device inventory, just knowing the full scope of devices you have, to where are the devices physically located, to how it's utilized, and how it integrates with your CMMS systems. So I'll hand it over to James for 10, 15, 20 minutes, somewhere in there for the demo. I highly encourage you to ask questions through that. I'll field those questions. I'll ask James to kind of dive a little bit deeper. The more you want to see the platform, we will gladly show you that so you can see how you can improve your day-to-day functionality. And of course, at the end, if we miss any of your questions, we'll be happy to handle those at the end of the presentation as well. So before we jump into the demo, let's talk a little bit about the state of healthcare cybersecurity. These are 5 stats that I really like to show. Most of them are new within the last 6 months or so. Some come from our studies, some come from our colleagues or our competitors. I'd much rather get a clear picture across the board than worry about any of that competitive strife. So the first thing that I find incredibly valuable, and I think this is from a Proofpoint and Ponymon study recently, is that almost 9 out of 10, 89% of hospitals in the last 12 months have experienced at least one cyber attack. I would actually say the other 11% have, and they just don't realize it yet. But the reality is, we all know that there's a lot of risk in healthcare. We know there's a lot of cyber attacks going on, and this data study did a really, really good job painting a picture of how widespread those attacks are. From there, we started to see that there is absolutely patient impact from these cyber attacks. To be very clear, we don't see many cyber attackers going and attacking patients directly, but the impact comes in the form of collateral damage. Effectively, they're taking systems offline. Whenever systems go offline, whether it's because of a cyber attack, a power outage, a hurricane, what have you, we're going to see patient impact. So we're seeing about half the time, 45% of the time, there are adverse patient impacts from attacks. We're also seeing about half the time when there's a ransomware attack, or half the time, 43% of the time, people have experienced a ransomware attack. And so when we see all these headlines, yes, ransomware is a big issue, but about half the time it's not ransomware, it's malware, it's phishing, it's something else. So there is a wide array of attacks out there. And then the reason we see so many ransomware attacks, there's such a high percentage of attacks, is because hospitals are paying. 47% of the time there's a ransomware attack, a hospital looks at the situation in front of them and says, it's going to cost us X amount, typically in the mid 6 figures, and we can probably be back online this afternoon. And while I'm not saying if that's the right choice or the wrong choice, there are 2 clear outcomes in that situation. One is they often get online rather quickly, and 2 is by paying, they encourage future ransomware attacks because there will likely be more payments. So we're in this really frustrating space of healthcare is under attack, it's vulnerable to attack, and we're encouraging attacks. The good news is there are things we can do to better protect against these attacks. Things that many other industries are doing, things like basic network segmentation. And I'm not going to go into too much detail, but effectively think of it as a way to stop all your devices from talking to each other when they don't need to, so attacks don't spread. So if you need to have any cybersecurity discussions, these are the 5 stats I always like to start with, and I can pass along references to anyone that wants to read them. Furthermore, this is the checklist I was talking about earlier. What can biomeds particularly or specifically do during an attack? And what I encourage everyone to do is if you have a cube or some common workspace, print this out, add to it as needed. But this is the checklist we see more and more people using and then saying, oh, you should add X or Y or Z. And I'm not going to go into too much detail. Again, we have a webinar from last month I can pass along, and you can get CE credits for that as well. But it goes from everywhere from alerting the right people to disconnecting devices to educating others as well. So feel free to take a snapshot of that. And again, if you want to dive into more detail about that, I will pass along the webinar link to do that. So with that out of the way, I did my cybersecurity primer up front. But the main goal of today's presentation is to actually talk about cybersecurity systems that are in place, kind of like Cynerio's platform that we offer, and show you how not only does that focus on cybersecurity, but it can also make biomeds more effective in their day-to-day job. So James, I'm going to hand it off to you. I apologize to the audience. This handoff can be a little bit clunky, but James, if you want to go ahead and introduce what you're going to talk about, I'm going to give you control of the screen.
Yeah, thanks. So I'm going to talk about, thanks, Chad. I'm going to talk about what we do from an inventory discovery perspective, how that's dynamic and automatic. I'm going to talk about how we can identify where devices are, where their locations are, and some of this is based off of integrations. The CMMS integration, what we can do in the what we do when we integrate with the CMMS, how we handle that kind of data, and then what we do from a scheduling and utilization perspective. What that means is how are devices being used? Are you getting the maximum usage out of those devices? And I'll walk through all of these in the demo here. Okay, so what you're looking at is the 3 pillars of Cynerio. The patient confidentiality, patient safety, and service disruption. I'm going to focus on the service disruption because it's what impacts biomed the most out of these 3. What we do from a service disruption perspective is by securing devices, we make sure that they're not disrupted by hackers or any other kind of attacks. And so everything that we do from a cybersecurity perspective leads into this. But what we do in all of our actions when it comes to mitigating or stopping the attacks, we'll make sure that there isn't service disruption associated with those devices. So talk a little bit about how we identify the medical devices, and we only sell to hospitals. We focus on medical devices. Even though we also have a focus on just regular IoT, your IP phones and cameras and these types of things. But our focus, our primary focus is medical devices. That's why you saw those 3 pillars the way that you saw them. What we do is we're a passive solution. We're listening on the network, and we're pulling in data, and we can identify all of the medical devices that way. So this isn't a static system where somebody has to put in the data to identify what devices you have. We're going to tell you what devices you have, and we're going to present it to you in the console like you're seeing right here. So diving a little bit deeper into this, I'm going to show you some IV pumps. When I clicked on the IV pumps here, you see that we're giving you all the data associated with all of your IV pumps, regardless of manufacturer. And we can drill down per manufacturer also. By clicking on those, I'm going to show you this here in a list. From a list perspective, there's a lot of data here, but you can get the data exactly how you want to see it. You know, if you want, I'm going to show you a little bit about location, and show you a little bit about integration with CMMS. But you can see that you can carve this data up exactly how you want to see it. You can filter and sort it, and then you can also create reports based off of this data, so that the data that you're seeing, you can continue to see. You want to see when devices are going offline, easy to do in here. But here I'm going to sort based off of a couple of access points. So they're wireless access points. This is one of the ways that we show you locations for your particular devices. Here we have a couple of access points that these devices are connected into or were connected into. We're going to show you historical information. But also through the CMMS integration, we can show you if the CMMS is showing these as lost or retired, whatever the status is from the CMMS, we can display it here so that you can show if a device has been lost or retired but is still online. That's important information for you.
Hey, James, I do have a good question. While you were talking about CMMS, this question just came in, and to the person asking it, I'm going to modify it a little bit, so let me know if we answered or not. One is, what information do you typically recommend our customers keep in their CMMS? Is it model numbers, serial number, things like that? And then two, because a lot of CMMS systems require manual entry, what data can we take from our automated discovery and give to the CMS so there's less error in data entry there?
Yeah, for sure. So the data that is in the CMMS, there really isn't a preference from our perspective, because we are gathering so much data ourselves. It really is an opportunity for the CMMS and Cynerio to share information, not overwrite any information, right? Who owns records? And actually, let me jump into a particular device here so we can talk a little bit more about what that is. So here's an example of an integration with the CMMS. Here's some data that the CMMS might be providing to us. It's not limited to this though. Whatever the CMMS actually has, we can pull in. Whatever data that we have, and you can see a lot of that over here on the left, we can provide to the CMMS. So those records in the CMMS can be dynamically written so that they match what we have, and same thing goes for Cynerio. So it's a very dynamic handshake there in information sharing.
Great, thank you. And again, thank you to the asker, the person that asked that. If you want any additional detail, feel free to type it in there, but I think we got most of what you were asking.
Yeah, for sure. Keep the questions coming. Okay, so we talked a little bit about that. You can see a lot of attributes here, data points that we have. Quite a few of these data points are actually just dynamically found by Cynerio by listening to that network traffic. But some of it is through integrations. So very heavy with the integrations. I talked a little bit about the wireless LAN controller, but it could be a variety of different integrations, vulnerability and all of that. Getting that visibility here from an individual device perspective. And then also, like you saw back there, from a group or list perspective, is a very important part of how we present data. We talked a little bit about wireless LAN controller integration and how we can show you which access points, and that's very dynamic. Something moves from one point to another, one access point to another. We're going to show you what that new access point is, because we know everything is very mobile in a hospital, especially when it comes to IV pumps. But the other integration that we have is with network management solutions. And this is an example of one here, pulling maps in that are in that network management solution and actually showing you on the floor where that device exists. This is important because sometimes just knowing an access point isn't enough. Usually it is, because people that manage those systems will usually label those access points in a way that's very understanding, 4th floor, west end, whatever it is. But this is important to be able to just pull this up. I know where the access point is. Now I'll be able to find this device. No longer running around just trying to remember where particular devices happen to be last time. This is one of the integrations that we do. We also integrate with real-time location services. Same type of solution. The idea is, let's get away from having these siloed solutions, get everything integrated, get all of the data together, whether it's us pulling data from them or providing data back. Very flexible from that perspective.
Cool. And I've got a couple more questions while you take a breath there. One you answered, which is, do we integrate with RTLS? Yes, absolutely. The good thing about both our system and a lot of these location systems out there is they're very integratable. So that's an easy question. I think this is also easy. How'd you get the hospital map there? What's that process look like?
Yeah, exactly. So this is actually a fairly easy process from our perspective because we're pulling it in from that integration. In this case, is with Cisco Prime, but if it's a network management solution, we can integrate, and the map actually exists in Cisco Prime in for this. And so we just pulled the map over dynamically. So what we do is in our integrations, we have a username and password for that solution. And we, not to get too far down in the weeds, but we use the APIs in order to connect to that solution. And then this data comes over to us automatically. Not a lot of heavy lifting from a biomed or clinical engineering perspective.
Yeah, and one of the things when we go to things like MD Expo, which we'll be at in a month or two, the biomeds love to see this because we hear so many biomeds just running around finding IV pumps in ceilings, closets, whatever. This is functionality where they can not only go and see where a device is, but they can see all the details about that device, see where there's patches that need to be implemented, things like that. So it really does help with the day-to-day efficiency. We've heard horror stories of biomeds just running all over campuses looking for different devices. This, through both integration and through what we do, is really, really helpful in improving their efficiency.
Yeah, for sure. And what we're doing in Cynerio, it's about making people's lives easier, whether it's the security that we provide and how we present that and give actionable actions that you can perform. Or whether it's the biomed here, we're not looking to make anybody's life any more difficult. We're trying to make everything easier, and that's what all of these features that I'm showing you are wrapped around.
Yeah, I like to compare biomeds to kind of nurses in a facility. Nurses make healthcare run. Biomeds make all those devices run, and anything we can do to make them better, everyone's going to be better off.
For sure.
Yeah, that's the end of my pandering to the audience. So sorry for that, but it's true.
Okay, so let's talk a little bit about utilization and what that means from our perspective. I'm showing you this individual device utilization right here. What we're doing is we're tracking how these devices are being used. Again, just based off of what we're seeing on the network, where every communication that goes on from this device, from any of the devices, is being tracked and graphed out here for you. And you can see that very dynamic graphs. Here we have, just one particular week. If you wanted to set it on any particular week, you could do that in here. Very customizable dashboards here. But looking at this from one device, and of course you all know why this is very important. This is important because do I know whether I have enough IV pumps in this case, or whatever the medical device is? Do I have enough of them? And then how are they being used? Can I move them around in order to make them make that usage more efficient? Or do I just have too many of them? That's the concept behind all of the utilization that we're doing here. And now I'm showing you the fleet utilization, how many of them are being used right now, idle, offline, and then total. But then graphing all of this out again for you, right? So you can see what are the heaviest usage times, and then what are the least heavy usage times.
Well, I'm going to stop you there again because we have two new questions. Audience, you're making our job easy, so keep these questions coming. The first is someone asks, can I live in my CMMS or behind some other system? Effectively what we call a single pane of glass. So can you talk about, one, do you have to log into Cynerio to see this data? And two, if not, how can you access it from systems that you already have in place?
Yeah, good question. So what you're talking about is console fatigue, right? And it's a big issue, or you might call it swivel chair. I have to swivel from one monitor to another to see data, one piece of data or another. And the answer is that everything that we do from an integration perspective is wrapped around getting away from that console fatigue. you do not need to log into Cynerio in order to get the visibility into the data that we have here. I've talked a little bit about those integrations that we have already, and if there's any use cases for any other integrations, then we're always open to making more of those. But the idea is we do it both from a security perspective and then also from a biomed perspective. Give you the ability to take all of this data and send it out to another solution, and do that in a way that that keeps that data up to date, in a way that you want to, whether it's real time or on some kind of schedule.
Cool. And if whoever asked that, if you want more detail, feel free to throw in the questions. Another question that came in: we are a hybrid deployment model, so our collector is on premise, and then what you're seeing right here is in the cloud. The question is, if there's some reason that they aren't able to access the outside world, there's a hurricane, there's a power outage, there's a cyber attack, can they get this data somehow? Is it available offline if they don't have outside access, either through our system or through those other terminals that they have access to?
Yeah, for sure. So all of the data that I'm presenting to you here, it is cloud-based data. It's what we call metadata. So it's not your actual data. It's what we took on site in our collector and created this metadata and sent it to the cloud here in a secure way. So all of that information actually does exist in that collector. All of this data that I'm showing you right here. So when we talk about integrations, we're not doing integrations from the cloud, we're doing integrations from that on-site collector and sending that data from that on-site collector. Having said that, you have the ability to log directly into the collector and pull this data and get that visibility into what we're showing you here in the cloud.
Cool. And I do want to talk a little bit about our Cynerio Live team, simply because the question asks about what happens in the event of a cyber attack. And we did cover this a little bit in the webinar we did in December. Again, we're doing a deeper version of this webinar in March, I believe, that I'll show here in just a little bit. But one thing that our research team does in the back end is a lot of what you're seeing here is automated analysis. But we're seeing that a lot of people get alert fatigue, right? They get so many notifications of things that might be happening that are just false positives that they're exhausted by looking at all of them, and they just throw it over in the corner. So one of the things our research team does behind the scenes is they take all the automated technology we have and the warnings that we have, and then we analyze them. So you're only seeing cyber attacks, for example, that are actually happening. And so what we talked about in our last webinar, as well as the one coming up, is when these attacks happen, because our team sits there analyzing these all day, every day, they're able to identify them really quickly and respond to them really quickly. And often when we see an attack, for example, we saw a kernel blue on a device the other day, which is responsible for the worldwide WannaCry attack in 2017 or 2018. When we see something like that, we often respond in a matter of minutes or hours, right? We measure typically below 2 hours in that case. So if you're under cyber attack, our team is able to see that in many cases and alert you directly. We're not going to say, hey, you have an alert in the platform. We're going to get our technical account managers on the phone. They're going to contact you. They're going to hit your phone, your email, however we need to alert you that we're seeing something malicious and give you instructions on how to stop it. So while that hybrid model can be a bit intimidating to folks sometimes, the reality is having that remote team in those critical moments is really valuable too. Another good question, great. Can you define idle versus offline? So if we look at the IV pump here, the status is offline. Can you explain the difference between those two?
Yeah, absolutely. So the idle means that we're actually seeing communication, but we can tell that that communication isn't actually, that the device isn't actually processing what it normally does, right? In this particular case, dispensing medicine, the normal function of IV pump. Then offline means that we're not seeing any communication at all for this particular device. This means a certain time frame has gone by when we're no longer seeing any communication. So it would actually show up here as last seen and tell you the date when it was last seen.
Cool, good one. Again, keep those questions coming, they're great. Jim,
Yeah.
back to you. You can continue with the demo.
Yeah, no problem. So last couple of things I wanna talk about here is what we do from an MDS2 form. So if you're familiar with MDS2 forms, they come from the manufacturer. Every manufacturer has to provide an MDS2 form for a device, and there's a certain amount of information that is associated with that. And you can see not every data point actually applies to a device, but what we do is we take those forms from the manufacturer and we digitize them, and we digitize them in a way that you can search them, and you can also drill down into those requirements to see if there's any other devices that match that same requirement. So in this particular case, we have this hardening. Can this device be patched? The answer is true, and then we can define that for the rest of the devices. Same thing with all of the rest of those. And then the last thing here is the FDA information. Obviously very important when it comes to recalls. We're going to call out we're going to give you that recall information immediately, whether it's FDA recall or manufacturer recall. And then the last thing I wanted to show here is what we show from a dashboard perspective. Everything that we have in here is hyperlinked out. So carving out information here, but showing it in a more visible way, so that you can, define exactly what you're looking for here. And if you want to look at it from different, carve it up for different sites, you can do that. Different classes, whether it's IoMT, medical devices, or just regular IoT, and you can carve that up, and it'll show the dashboard in that format. And that's everything I had from a demo perspective. But does anybody have anything else that they want to see while I have it up here?
Yeah, I do have one question, and folks, while we answer this, keep them coming. The ADR, the bright red icon in the top left caught someone's eye, and it goes along with what I was talking about with Cynerio Live. So can you explain what attack detection response is, why that's red, how we help customers there?
Yeah, for sure. Let's talk about the architecture that we have here. So we actually have three distinct products within the solution. What I showed you today was inventory and visibility component. We also have a risk reduction component where we analyze any vulnerabilities, and we can reduce all the risk that's associated with that. And then the third product is this attack detection response. This is that real-time analysis about any kind of incidents that when it comes to security of these devices. Zero false positives. And of course, all of this data can be sent out, but zero false positives because of our Cynerio Live team. Everything that is being brought up into this console is automated. We know from modeling about how these devices should be communicating, and anything that's anomalous or anything that is outside of that, anything that might be suspicious, we're going to call out in here automatically. And our Cynerio Live team looks at every single incident and makes sure that it is in fact anomalous, suspicious, and it's a cybersecurity incident. What we mean by that is, is this communication from malicious domain? Here's a couple of examples. Is there an exploit from a medicine for a certain vulnerability? And then exploitation for another vulnerability down here. It's one of the things that our Cynerio Live team does. They also perform a variety of different analysis of all the medical devices for vulnerabilities that aren't even known about. And we've actually documented and presented to manufacturers vulnerabilities that were unknown even to them. We've identified malware that was not known to anybody, because we have that visibility into the medical, our focus on medical devices, how they should be communicating. Anything outside of that, we do an investigation with our Cynerio Live team, and they can identify malware that isn't even publicly documented.
Well, good stuff. And I'm going to bring us more on our journey between biomed and security. We're going to go back to biomed here for a little bit. Good question. When a device is offline or last seen, can you still locate it? If not, what information can we give if it's offline?
Yeah, good question. So we can still locate it because we're keeping that historical information that we already had about what access point it was connected to, or if RTLS is involved, or network management systems are involved. That information stays in there. In fact, the one that I was showing you here earlier, where we had the map, you can see that this one hasn't been seen for almost a year, and this is the last place that it was actually seen. Good question.
Yeah, it is a good question because we can't make magic happen, right? They have to be communicating, but we can at least give you an idea of where it last was. Okay, we're going to jump back into the security realm now. We have a couple good security questions here. How does the system evaluate the risk assessment in its score? So I'm going to add to that. Can you talk a little bit about how we evaluate both the risk score and the likelihood of exploit?
Yeah, absolutely. So I'll jump over to our risk tab here and talk about that because we're performing a variety of different risk analysis here, and of course, some risks, some vulnerabilities are higher have a higher score because they're more exploitable. And that's what we're doing here within the solution. You can see that we have a couple of different scores when it comes to the risks in here, and it's based off of severity and probability. Severity, the CVSS score; the probability, this EPSS score. EPSS is an exploitability score. What it means is that a particular vulnerability in here has a higher or lower probability of being exploited. And there's a lot of analysis that is done in that, in what has been exploited in the past and a variety of different things. It's a very detailed list. But what we're doing is we're combining these two scores here to create our risk score. These are both industry standards. We're not coming up with any risk scoring on our own, but we're combining those two scores to give you the ability to identify where you should put your focus first. Good question.
Yeah, it's a good question, and it's, anyone that's worked in security for more than a day and a half knows that you have to balance both that likelihood and the risk, right? If you have something that's high risk but it's not exploitable at all, you don't really have a risk there. So balancing the two on that chart on the left, you can see those little red dots in the top right are incredibly valuable because those are the things that are high likelihood, high risk, and you should drill down into quickly.
Exactly.
Another question. We have two more coming up, so guys, keep these coming, and ladies, keep these coming. These are great. Does the system come with a vulnerability scanner? So again, I'll add to this a little bit. Can you talk about, one, how we identify these risks, and two, how we can complement vulnerability scanners that are out there? And then finally, three, I'll add another twist. What are some of the challenges with vulnerability scanners in healthcare in particular?
Yeah, lots of information there. So what we do isn't native vulnerability scanning because of our passive nature. We do integrate with vulnerability scanners, and that's twofold. The same thing that we talked about with our other integrations. What data can we provide? All of this risk data that we've identified here with these devices, and then also what data can we pull from those vulnerability solutions. What we have within the solution is actually an IDS, intrusion detection system, is part of what we're doing. The analysis that's happening, which isn't that native vulnerability analysis. The reason that it's important, that it's very complementary between us and the vulnerability systems, is that medical devices, IoT devices in general, but especially medical devices, should never ever be scanned by vulnerability systems. And what we find is that they are being scanned by vulnerability systems. The concept is if they're connected to a patient or in any way, they shouldn't be scanned by any kind of vulnerability system. And so what we do is we do a twofold analysis. One, we're providing all of this data to the vulnerability system. They know what these medical devices are. So in the vulnerability systems, they can stop any scans that they have. But we also will provide them with a list of all the medical devices that are being scanned today, so they can just break it down immediately and stop all of that scanning. We also provide them with all of the devices that are on the network that aren't medical devices, and are not being scanned. So we're trying to get a holistic view of that vulnerability, and that's how we do that integration with vulnerability systems.
Yeah, and again, scanning is a much, much deeper discussion than we can cover. We could probably do a whole webinar on that. So to the folks asking the question, if you want to learn more about that and how we balance passive and active analysis and some of the risks there, we're happy to talk to you offline, and I'll put my contact info up there in a little bit. Jim, another one came in, so these are great. This is about how when devices get added or taken offline. So what are the current rules, triggers, or protocols for when a device is added, and what are the rules, triggers, or protocols for when that device is removed?
Yeah, that's actually pretty simple. So when a device gets added and starts communicating, it automatically gets added in the solution here. No manual work is necessary. We're going to take it, define exactly what it is based off of a lot of different criteria, define exactly what it is, who the manufacturer is, and all of that. Put it in a particular bucket here, and then we're going to keep that in there for an extended amount of time, even if it's taken offline. And that's important because some devices are put in a closet for a month or two, pulled back out, thrown back online, and we have the historical information, historical context about that particular device. But the time frame associated with the device actually being taken out of here, and we can manually take them out if that is a requirement. But the automated method of having devices taken out is set at 1 year, and of course you can set that to whatever you want. But default, it's 1 year. Device stays in here, and then of course you have the ability to manage those however you want.
Cool, great question and great deep dive. I'm sure more questions are going to come in. I'm going to have to ask Linda if we've set a record for questions on this one because we've got some good stuff. But let me go ahead and share my screen. There's a couple of housekeeping things, a couple more details. So if you can make me, let me do this. Connect it to audio. Let me try it one more time. There we go.
There you go.
There we go.
Yep.
All right, cool. Good, there we go. So a couple more things. Oh, that's the White Mountains in New Hampshire you saw there briefly. So a couple more things before we wrap up for today. And again, keep those questions coming. I am happy to have Jim do more demos here. First, I always like to give people 3 steps that they can take by a month from now, which just happens to be Valentine's Day. So there's 3 things that I want to call out today. First is do some level of CMMS analysis. One of the really great things about the engine we've created is that while to get full value out of it, you do need to deploy it, and we do need to be performing passive analysis of traffic. But we've built up so much good information in that analysis engine that we can take a rather basic CMMS data dump, sometimes with only 3 or 4 columns in your CMMS system, and do a full risk analysis on that detail. So if you want to do a CMMS analysis, I'll show you what that looks like in just a second. It's something we can turn around rather quickly. So do reach out if you want to start there. Next is start thinking about in terms of risk prevention in terms of healthcare focused detection and response. And Jim showed this a little bit earlier with our attack detection and response module. But effectively, a lot of hospitals have a lot of traditional IT systems in place. And those IT systems are doing a very, very good job at protecting against the attacks that they're meant to protect against. Unfortunately, there is ample evidence out there to show that they're not protecting the full healthcare environment, both in terms of IoT devices, which seems to be the wild, wild west, which we continue to really help our customers protect against, as well as some more traditional attacks, things like attacking Windows 7's machines that unfortunately are still out in circulation. So start asking your vendors, start asking us how we help protect against those healthcare specific attacks that seem to be hitting everyone so hard. And then finally, we're not an MSSP or MSP. We do have a partnership with a lot of those folks. I always encourage people to engage with their MSSPs in particular, simply because they have the skills not only to help biomed teams, but to also help security teams stand up richer security programs on relatively short order. they have the expertise that others may not, and they can bring it in at a rate that is sometimes lower than if a hospital were to stand it up themselves. So if you're looking for takeaways of actual actions you can take within the next month, analyzing your CMMS, learning more about protecting against healthcare attacks, and engaging with MSSPs are absolutely the place to start. Now, we have had a bunch of CMMS discussion today, so I did want to introduce you a little bit more to the CMMS analysis. Effectively, it's a low-touch evaluation. You do a data dump, you send it to us over a secure channel, we analyze it. About a week later, we have a full report with a full readout call with our research team. It's pretty straightforward. If you want to learn more about it, you can email me at chad.holmes@cynerio.com, or you can go to our webpage at that QR code there. I'm happy to pass along details to anyone else. In terms of what that report shows, it's a high-level dashboard, very similar to what you saw as Jim was going through the Cynerio system that tells you the top risks, the affected devices, the number of devices. So in this case, you can see version 11 was on 188 devices. GE ultrasound, there were 12 instances of eternal darkness, which was responsible for WannaCry. So this is a rather detailed report. Again, that was just a data dump and a secure transfer of that data. We can get to you rather quickly. So feel free to reach out to me with any questions or requests to dive deeper into that. I do want to make it clear we do have that broader platform. James is really just hitting the surface of what we did today. He showed you the attack detection response module. He got a little bit into the preventative risk management functionality, but not only does that show you your devices, but it will do things like generate all the microsegmentation rules you need to properly protect your entire network. I mentioned it earlier. This is a type of defense that other industries have been taking for well over a decade. Healthcare is unfortunately just behind the 8 ball there, and we speed up the generation of those rules, the testing of those rules, and ultimately the deployment and protection that comes with them. We also have technical account managers. Those are the folks that if there's an active attack or if you just need help standing up your program, they help. And of course, our research team, a very rich research team that we call Cynerio Live, that not only helps customers in a time of attack, but the research they do feeds back into our product. So it really is a combination of innovative protections that are constantly evolving based on the research that they're doing. And we do have a couple of different webinars and events coming up. One thing that our research team is working on right now is we're finding significantly more patient records are exposed than hospitals realize. And I'll give you a great example that will also lead into the second webinar. We found a smart whiteboard in the last couple of weeks that held thousands and thousands and thousands of patient records because someone did a presentation, it was all cached, and it was all widely available. There were no protections, there was no auditing, there was nothing protecting this patient data from being exposed to the outside world. So we're going to talk a little bit about the compliance challenges we're seeing around protecting EPHI, a nice Valentine's Day webinar that we're doing through Bright Talk with my colleague Raleigh and myself. So feel free to join us there. Also, if you joined us for last December's webinar on active attacks in healthcare, a few people asked for us to go even into more detail about the attacks and give very specific examples of what we did, how long it took, etc. So I'll be working with Asher again yet again on that one on March 14th. Of course, we love MD Expo, as do most people that join these. So we'll be at MD Expo from April 11th to 13th. And we do have another webinar Wednesday coming up on May 17th. We haven't determined the topic of that webinar yet, though, but I hope this crowd and more will join us there. So with that, I'm going to go back and take a quick look at questions. But if you do have any questions after this, feel free to reach out to me at chad.holmes@cynerio.com. And let me see. Linda, do we have any other questions that popped up that I may have missed?
Yeah, there is one. Is there any worry if someone gets into your system, i.e. hacker, malware?
Into the Cynerio system that tracks all that data. Jim, do you want to talk about that a little bit? What happens if we get hacked into, and of course, what protections do we put in place to make sure that won't happen?
Yeah, for sure. So we're actually the systems that we have are extremely hardened. There isn't a concern because of how they're hardened. We're not the devices that we use are standard operating systems that are being hardened on a regular basis. And then the communication that we have, the metadata that goes to the cloud, is sent in a secure fashion. Good question.
Yeah, and I'll add to that. And I don't mean to sound flippant, but I do want to talk about the reality of healthcare hacking right here. An incredible number of hospitals are incredibly vulnerable due to a lack of investment in cybersecurity. And so while attackers may come after us or our competitors to get access to the information we have, the reality is it would be much easier and much more profitable to attack individual hospitals and find ways to get them to pay ransoms or at least expose patient data than it would be to attack us to get into those. The other really important thing is in many, many cases, the data they're after is patient data so they can sell it on the black market. Our systems don't hold that patient data, right? We just start it immediately. It never goes to our cloud system. It stays in the environment. We never even look at it, right? It gets discarded as part of our on-site analysis. So there's no patient data that we hold that would be valuable. And honestly, we're just not the easiest path to revenue for them. So in many cases, attackers do not focus on vendors like ourselves. Good question.
Okie dokie. Another question is, how do systems like Cynerio differ from network and IT device scanning tools that some of our colleagues use?
Yeah, good question. Jim, I'm going to throw that back to you. You talked about it a little bit earlier, but can you talk again about passive versus active analysis?
Yeah, exactly. So there's vulnerability systems, and there are some other probing systems, and we're the opposite of that in that we're passive. So we're listening on the wire, is what we call it, on the wire, which means that we're listening to all the communication on the network, and that's how we present data. So we're not connecting to any devices. We're not probing any of those devices.
Okay, another question here is there a way I can download this tool or install it quickly just to see if it will work for my team?
Yeah, it's a good question. So because of how we deploy, there is no easy download. That said, the CMMS analysis, and let me go back here a little bit. Here we go. The CMMS analysis that I mentioned is a rather quick. I think the quickest we've seen is someone, while we're on the phone with them, download it and send this to us in 10 minutes, roughly. So this is the easiest way to get started. It's a matter of often just sending a CSV or an XLS file to us. We do the analysis and get back to you for a quick report. So we're not quite as easy as download and start analyzing, but this allows for the easy entryway into that first pass analysis.
Yeah, and if somebody wants to do a test, feel free to reach out. We can get a collector on site fairly quickly, and it's just a couple of steps in order to set it up, and that's what we've been doing with our customers for the last few years. So.
Okay, what about this one then? How much more efficient will this make our biomed team?
Super duper efficient. It's really hard to say the numbers there. If we go by, the worst case scenarios where we've heard people marching around for hours in some cases looking for a cache of devices, again, on big campuses, it's hard to measure by those worst case scenarios. I would say anywhere to a 10 to 15% uptick at a minimum, just because all the data from location to patch information to risk information is right at people's fingertips. Jim, say if I'm wrong there or too far off.
No, you're hitting the nail on the head. It's about creating those kind of efficiencies. If nothing else, getting a true inventory of your devices and knowing exactly how many you really have.
Great. Well, just before we wrap up, James, I've got a question from an attendee who's asking, is that Teddy Roosevelt on your wall?
That is Teddy Roosevelt.
There you go. Question answered. Thanks so much. Okay, well, we're coming up to our hour. So thank you, Chad and James, for your time and for a great and informative presentation. And thank you to everybody for all the questions that came in for them both. I'd like to encourage everyone to visit today's sponsor to learn more about the products they provide to our industry. So please visit Cynerio.com. As promised, the answer to today's trivia question is Bugs Bunny. So congratulations to our winner, Tim Bloomer. A quick reminder, you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once you've submitted the survey. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll be back next week with another webinar, so please visit webinarwednesday.live for more details and complimentary registration. Thank you once again for your time today. Enjoy the rest of your day, and we'll see you next time.
Thanks, everyone.